In terms of health, physical activity, and several other these issues, the question is not really what has to change, but how do we get it to change? So I'm going to say a few different things about what I think systems thinking is and see how that may help in an understanding. And one of the things that systems thinking is, from my point of view, is an operational way of thinking about things. So it's not just problem description. It's trying to understand how things are interrelated in relationships of cause and effect towards understanding how we get change to happen. And I'll talk a little bit more about that in a moment. I guess it was really helpful to have both Sharon and Adrian's introductions were great and really interesting talks, and introduced quite a few of the concepts that I'll come back to in talking about what I'm going to say. But I'm going to start very macro and then move very micro. So at the very macro level, we know things are broken and there's a lot of complex problems happening concurrently. And so one of the major situations we're all fairly comfortable as a problem, 99% of us, is climate change and the impact of climate change. And in the last 5 to 10 years, the Lancet Obesity Commission has been tasked with thinking about what the future of work to prevent obesity looks like. And 20 years ago, we heard a conversation in the last session about we're worried about individualising and victim blaming, and completely agree with that. And in fact, one of the things the commissions came to was this idea of thinking about obesity in the context of a global outcome. And in fact, it's part of several different intersecting systems. And one of the critical things the Lancet Commission did is flip this on its head and say, well, hang on, at the centre of all our thinking needs to be natural systems, then societal determinants, and we heard about governance a little bit in the last time, then the human element of this, and then the environments in which they live. And in fact, if we're to think about one of these things, we need to think about all of them: ecological health and well-being, human health and well-being, social equity, and economic prosperity. Now, if I'm an emerging leader, all of these are really interesting, critical, important, wake me up at 2 a.m. style problems, but considering them all at the same time is almost completely overwhelming. And that's the problem that faces most of us when we try and use our current scientific method to think our way through solutions here. And in fact, what we posed here was the global syndemic, and this idea at the top that overweight and obesity, undernutrition, and climate change are actually functions of the same problem. And Sharon talked a bit about consumptogenic environments a moment ago, and that's kind of what we're getting at here. And that is that we haven't really appreciated the intersection of our economics, our policies, our land use, our urban design, our hospitals, our families, our communities. We haven't considered those as a cohesive whole, and nor have we considered the way that they interact to create or undermine these various aspects of health. And so the call is not what, we know these are problems, but how. How do we do something about it? And I'm going to change gears and I'm going to show you what that looks like at a micro level. But there's two big calls for emerging leaders to think about. Can we think about a global syndemic? Can we look for common causes and common solutions? And can we create the sorts of platforms across silos to work on what are called double and triple duty actions, which means actions that hit multiple impacts of the nutrition, food, physical activity, environment, and climate change all at once? And the short answer is yes, but the long answer is how do we do that? And that's a big part of the work that we've been working at for the last 15 to 20 years. And one of the key aspects of that, one of the key questions is, okay, we know that building capacity is an important thing. We know we need local ownership of a problem. How do we put the tools in the hands of the people who make decisions to see that complexity, share that understanding with other people in that system, and find places to make change? So we invented a piece of software to help us do that called Sticky, and I'm just going to show you a couple of basic examples. This is how supermarket owners think about the current content and scaling of their the offering in their supermarkets. So they have promotions and price, customer demand. There's a gap between customer demand and supply. That gap leads to advertising campaigns, leads to conversations with suppliers. The suppliers change promotions. You can see there are loops of feedback here. As the gap between customer demand and supply changes, the supplier produces new products we get new supply affects gaps. So all of a sudden, we've got a non-linear version of how this system works, and we're starting to see that we may be able to tip one part of this system over, and by changing customer demand, we might tip a whole cycle of change in demand and supply and advertising, and also change suppliers and have effects on what suppliers produce as new products. Fabulous, great. Spend 20 years drawing a picture, what do you do with it? Not much use when COVID comes along. A second critical aspect of systems is the ability to understand the impact of time and respond to shocks in the system in real time. And so this is actually from a community in Western Victoria. And what happened when COVID hit? We started this work before COVID hit, and we taught them how to use this software. And the next thing they did is they came back to us and said, yeah, that was all great, and we were working on improving the quality and healthiness of the food, and we were working on this system. And then COVID got us. And this is how COVID affected the existing food system as far as the supermarket owners were concerned. There's a critical point to make here. We all agree we need to be healthier. We all agree we need to address the climate. But if we think we're operating in a static system that's going to behave itself and respond in the way we think someone's systematic review tells us it will, we're kidding ourselves. What we need to do is understand the dynamics and use it. And a large part of what we're doing is teaching people how to understand the complexity of the situation, how to find the places where work needs to be done, and then how to respond when things change. And I'll just make a really salient point. It's not like we don't know how to prevent this problem. We do. The question is not what, but how. And we've run several trials. We've worked in about 240 communities worldwide in preschool, primary, middle and secondary school kids. We've done a bunch of work that's been translated into state policy. And what we've learned is what works has to operate with multiple strategies across multiple levels of the community. And it's hard to implement and it's hard to make sustainable. So we have to embed it in normal practice, and it has to be locally owned and locally led. Whether local means federal cabinet or a local school, we have to give people the tools to do that work. So just to give you a sense, here's some of the places we're doing this work worldwide. And Adrian was kind enough to mention Bristol and Sheffield. They're two places that we've trained in doing this, and we had some pretty significant input into Public Health England's advice to local communities. But there was a question about municipalities, and this is Victoria down the bottom here. Each of the shaded areas are places where we've trained and are working with people to use systems thinking to improve the health of populations. And we've got about 42 of the 79 local government authorities here. We've also got Campbelltown in southwest Sydney and the ACT here, where what we do has become a policy position. And we're very pleased to say that this is growing in the next couple of years. So we have got the tools and techniques to work at a local government level, and we're now moving pretty significantly to do that. Now, this is called a horrendogram by my Vice-Chancellor. I'm not expecting you to read it, but this is what it looks like to southwest Sydney, to Campbelltown, when we ask them, what are all the drivers of childhood obesity in your community? And you can see they've got a whole bunch of work around physical activity, a whole bunch of work around food and nutrition here, around education and skills and social determinants. Critically, this is school kids, business leaders, local government, health professionals, educators and others coming together to describe the system and use this as a basis for a plan. Overweight and obesity, obesity prevalence, bad behaviours of individuals does not feature here. It is not part of this story. We're interested in the way in which environments interact with people to affect their health. And what we can do with Sticky is track action. So at 3 months, each of these hollow boxes represent an action hitting the system at some point. At 2 years, each of these hollow boxes represents an action hitting the system at some point, and we can understand the way actors, each of these are individual people, interact with each other to make an action happen to hit the system. So not what, but how. What are the tools and how do we teach people to do this work? We've trained about 2,500 people worldwide to do this work. And I'll just finish with a couple of things. The first is, in 1980, prevalence of overweight and obesity amongst kids, about 8%. And that adults in 2017, that was about 2/3. Our kids at the moment in Western Victoria, 35 to 50% are overweight or obese. What does that mean when they become adults? Now, I'm not doing this to point to the individual child and say that's a problem for the individual child. When we work with the community, they frame the problem. So they will frame this as how do we improve intergenerational health? How do we improve the food system, and so on and so on. But at the scientific level, these are important measures. And I'll close here. 1945, 85% of doctors smoked. All doctors were men. I went to see my doctor with a cough and he would say, have a cigarette, lad, and tell me what the problem is. Now, if I lit a cigarette in a presentation now, it'd probably be an instant sacking. Now, it's taken us 75 years, advances in treatment, advances in prevention, advances in social marketing, and on and on and on to get to the prevalence rates of 12 to 13% smoking now. And my question is, how do we do that for the healthy weight of our kids so it doesn't take 70 years? I suggest we work together in a collective way, and underpinning that has to be an understanding and an application of systems thinking.